Evening and welcome once again to yet another fantastic episode of Healthy Living on Ncdohtv. I'm Malika, the man with the Midas touch, and this is brought to you by the Northern Cape Department of Health. The month of October has been declared a mental health month, and what better way to conclude this month with a special guest in the studio who is the author of the Northern Cape Mental Health Strategic Plan. It's a thick document, but we won't have time to discuss everything, but we just want to talk to you about key issues. Who am I talking about? I'm talking about Yvonne Magxala, who is in the studio with us, and we're going to chat about this particular issue, mental health, as we round it off. And remember that only October is declared as the month, but mental health issues are everyday issues. We could be walking around with mental health problems that we are not aware about. So the trick is go and talk to someone. Magxala, am I correct?
Yes, you are correct.
Yes. Welcome to the show. Good evening.
Thank you so much for having me, and good evening, sir.
Now,
and
tell
good
me.
Good evening to your viewers also.
And they're there, hey?
Yes.
They're there. They're going to be part of the conversation. They're going to comment. They're going to send questions. They're going to like. They're going to share. It's going to be a social media party. Now, the first question, what is the primary goal of the Mental Health Strategic Plan that you're an author of?
Okay, before I answer you, let me just say to you, we are really very happy to have such a big achievement to at last have a provincial mental health strategic plan. Our primary goal, though, is to have direction, a strategic document. If you have it in an organization, it determines the direction the organization is going to take when executing anything, particular mental health services.
Now, how will the plan then address gaps between, that we have in the mental health services in the Northern Cape?
Yes, by the fact of you have taken an initiative to develop a plan, then it means you want to do something about the gaps. So, because the strategic plan, there are some processes that you have to follow. The first, you have to identify those gaps. And then after identifying the gaps, then you have to take a decision on what you are going to do about the gaps.
What measures are in place to ensure that this particular plan, because a document is a document, a plan is a plan, up until it's implemented. So how are we going to implement this plan effectively?
I think within the plan itself, we have outlined how are we going to get there. Hence, we say it's a strategic plan. So there are, yes, measures that we have put in place on how we're going to execute it. As we speak now, we are having collaboration, I can say, with the National Department of Health. It has got some monitoring in place. We have quarterly, we are supposed to report as to how we are executing our provincial plan, but also internally, we are having all those quarterly plans, monthly plans, where we are checking ourselves, how are we going forward with plans, and we have tasked some certain units with regard to what is contained in the plan. Like if I can make an example, what we want to do with the infrastructure in as far as mental health is concerned, we've already tasked the infrastructure unit. So we are always monitoring progress of the infrastructure unit as to how far are they going with what is entailed in the plan. And on the district also, we receive a report as to how far are they achieving some certain objectives which are related to their level.
Now, one could ask, what's the plan? What's the plan? How are we going to really help our people, especially the young ones and the elderly that are so vulnerable in terms of mental health issues?
Mental health service by its own nature, is a service which focuses to the vulnerable people, be it a child, be it an adult. So within our plan, we have made or we've catered for the vulnerable children. We have objectives which are talking to what are we going to do about the services that we give to children, what are and then objectives with regard to the services which we are going to give for an adult. So the plan has got everything. It's a blueprint. There's no ambiguity about it. Everything is there in the plan. Everyone is clear. When you come to work, you know, when you think about mental health, what is it that the mental health unit wants to do? Then if you just open the document, then you know what we are supposed to do. Even when we want help or you want to help us, then you can just look at what you can help us, which objectives can you help us with. Activities are there. The document, it has got also some standards that we are supposed to acquire. So we've set the standard, we develop objectives, we've got, objectives which would, our objective has got activities that would, will have to perform so that we can realize our objectives and at the end, our goal.
Now, communities out there, as we all know, that anything in government needs participation of our communities. Without them, we don't have clients. How are communities, stakeholders, NGOs, how are they playing a role in terms of assisting you, or will they be playing a role in terms of assisting the department in executing this plan?
Well, as you know, before you can start developing any plan, there are a lot of consideration, a number of consideration that you have, and there must be a lot of involvement from various stakeholders. If you don't do that, then your plan is not a plan which will be addressing the needs of the people. So the communities, much as when we conduct our situation analysis, part of that is to hear what the people are saying. Stakeholders, let me say, internal as well as external stakeholders. We involve them. Like I can tell you that this document is widely consulted. There has been a wide consultation on it. It has reached a number of stakeholders, which include even your organized laborers. They always have a vested interest into what is happening in health because they've got members in the Department of Health. Your internal stakeholder, the people who are working with mental patients or mental health care user, to use the proper word of the Act, the mental health care user, you have them. They know the strength. They need to have input and influence in the document. So that has been done during the process of the initial phase of developing the document.
Now, what other strategies are included for promoting mental health awareness within our communities, and also reducing stigma? Because, I remember as I was growing up, and you see somebody with mental health issues, with lack of understanding, they used to be labeled. What are we doing to make sure that our communities out there are aware of mental health issues and awareness, and to reduce that stigma?
Well, in this day and age, I can tell you that we've got a number of platforms whereby we are making an awareness. We can go to town about that. We've got technology which is assisting. We've got communication people who are assisting us with your various tools that you are using. We've got media. Social media also is also, although you have to put a control on it. We've got social media platforms, we've got newspapers. We are so lucky these days. We've got numbers of platforms. You get people who, like young people, who would prefer YouTubes, who would prefer podcasts, who would prefer Facebooks, and then you still have those people who are old, who cannot read, who are not, technology wise. So you get them, you still have to cater for them also. That process of making awareness, you are just trying to deal with the stigma, because if people understand and have knowledge, they would know what to do when someone is having mental illness.
Well, we're chatting to Yvonne Magxala, who is the author of the Northern Cape Provincial Mental Health Strategic Plan, and we're just chatting a little bit about the plan, how it's going to be implemented. Join the conversation by simply asking your question on Facebook or on our social media platforms, and also send your comments, like the page, and really be part of the conversation. Whatever question you have, we'll forward it to her. She'll give the answers, and we'll gladly give you those answers. We are going to continue the conversation with Yvonne right after the short break. We'll be right back.
I'm Fabian Flores, and I'm the CEO of Abraham Iso Hospital in Calvinia. Abraham Iso Hospital is a 33-bed Level 1 district hospital providing healthcare services to the communities in the Handam municipality and the Karoo Hoogland municipality. Our package of care consists of a 24-hour emergency unit, maternity unit, operational theatre, and the inpatient department. We have outreaches to all the facilities in our catchment area on a weekly basis, which include a medical officer as well. In 2022, we've worked hard to ensure that we implement all policies effectively to ensure that the clients received quality health care in our facility. We also have a visit from the Office of Health Standards, which identify our challenges, and that assists us to ensure that we bridge those gaps and ensure that quality healthcare is given to the communities. 2023, we will go forward with that, and we will make sure that we work on an improvement plan. We also plan to have community engagements using our ward councillors and our speakers. By using these platforms, we will ensure that the community are educated and informed of our services and what is happening in healthcare on a daily basis. I thank you. Thank you very much.
Welcome back. This is Healthy Living on Ncdohtv, coming to you live on Facebook and YouTube. So be part of the conversation. Either you watch on Facebook or you watch on YouTube. And this is your show. We would like you to be part of the conversation by simply commenting or asking your questions on the comments. And tell your friends to tell their friends to tell their friends and tell their aunties that this show exists as Healthy Living on NCDOH. Brought to you by the Northern Cape Department of Health. Yvonne, and we are talking about mental health as we round off the month of October, as we know that it has been set aside as the Mental Health Month. And today is the last day of that month. But mental health problems and issues, we will continue talking about mental health each and every day. It's a 365-day issue as we are navigating through our lives, the busy lives that we live in. It's work, it's taking kids to school, it's a stressful environment. And you might be experiencing some stressful times. You might be having issues of coping. Those are type of mental health issues that you need to talk to someone about. The Department of Health is there. Come to us and speak to someone, especially as men, because we don't really talk much about what we feel, which might influence how we think and our mental health capabilities. So, Mamadala, how will this plan on the implementation of it therefore be funded?
Well, the fact that we've got a plan with timelines, and remember our plan is costed. Already, we've got an idea as to how much is going to be required. So within our budget, in our various units, there are some prioritization within the budget. Yes, the plan is big and it requires a lot of resources, more especially financial resources. Infrastructure to build a mental health unit as we are required, as we have planned that we are going to, in 6 hospitals, we are going to attach mental health units. That's a huge amount of money that is required. But like we've said, we've got timelines. We put timelines of up to 2030. Within that, we're going to do everything in phases. We're going to do phased approach. So budget prioritization, and then we are, as we speak, at the stage whereby we are in a design stage in terms of infrastructure. So there are there's a budget which is already allocated within the infrastructure unit, and with regard to capacity of human resource, increasing human resources later on going to help us into further implementing the plan. So we also have prioritized some budget for that. Within the government department, we have to prioritize money. Money is not readily available because there are a lot of competing issues. So we have prioritized. We are going to do a phased approach, little by little. We will reach our target as we have already indicated in the plan.
Well, what are the key challenges that you might anticipate in terms of implementing the plan moving forward, and how are we going to mitigate through those challenges?
Well, like I've indicated that in the beginning, that when you start developing a plan, you involve your stakeholders. And when the plan is completed, you sell the plan to your stakeholders again. You remind them that this is the plan, you were part of it, this is what is going to be done, now we need to implement the plan. They need to be aware of the direction the department is taking in terms of mental health services, the goals that and the objectives that we have set for ourselves. That way, if everyone is aware of the direction which the department is taking, then they are going definitely to, when they do the rollout plan within their various units, they will include also, they will remember that we've got mental health objectives which we also have to be mindful of, and then this is how we're going to roll out so that we can assist the unit to achieve this, because this overall is the plan of the department. It's not only a plan of mental health unit, it's a departmental plan. So we have to inform our internal stakeholders about the plan, that the plan is here, the plan is approved, there's a commitment from the department to implement. Now, as soon as you got your stakeholder buy-in, into implementation of the plan, then you have already dealt with all those challenges which might make the plan not to be implemented. But we have the monster. We all know that, we are in health department, and health department is always on the edge. There's always a new thing today and a new thing. So some other things which might are those things which are unplanned. Like we had COVID at some point. It was unplanned. Budget or monies had to be, moved from certain activity to certain activities. So we also have, when we plan and prioritize, know that we can also, we must anticipate that there might be things like that. Those are the things that we also have to plan and put some, we say we're talking about contingency, we must have contingency plans that in health these things might happen. But over and above all, you need to have a political will. You need to have your principals within the department, your HODs, chief directors, to buy into the plan. And as they buy into the plan, they are also going to assist into, making you put things or prioritizing or influencing others to do the right thing.
How does our plan in the Northern Cape align with the national and international mental health policies and framework?
Yes, like I've said in the beginning, we do situation analysis before we develop the plan. We take consideration of number of issues before you develop a plan. You must get the views from your stakeholders, look at the important documents like your legal framework, your national policies, as well as your WHO. By the way, WHO informs every policy, every legislation which is being developed. So by mere effect of, taking consideration of what is the national policies or the legislation, you've already, by the way, have taken into consideration what the World Health Organization is saying, because that process of all countries will go to that WHO, come with a mandate, and then come and develop what the WHO says, and then from national tells provinces. The provinces also do some development of mandated by what national department has said, and national department has been mandated by what WHO is saying. So we really, this plan is aligned to the national mental health policy, to the Mental Health Care Act, and to a number of important legal or legislation and policies, norms and standards, which has got influence in what we are doing. Otherwise, if we do it our own way, we wouldn't know what is the mandate of the national department. If it says centralized services, we need to include it in our plan that our services need to be central. This is also one area which makes the department to take a decision of developing a plan.
Now, your final message to our viewers out there of the Northern Cape in terms of mental health.
Yes, I just want to say to the viewers out there, to say mental health is real, or mental illness is real, and we need to keep mentally healthy. And on our day-to-day activities, we must be mindful of the fact that we are keeping healthy. So this month, as we've already explained, this is the month which focuses on mental health. So we must try by all means to empower ourselves with what is mental health, so that we can know as to what to do or how to help others, and to help others to seek a treatment early enough, so that they can always stay mentally healthy.
Magxala, thank you so much for joining us on Healthy Living, and we wish you the best in the implementation of the plan. And I'm looking forward to chatting to you once again so that we can unpack the plan and really zoom in bit by bit, and so that our viewers at home are aware how we are going to bit by bit implement this plan, like more like the NHI, as you know, bit by bit we'll be implementing it. And what a coincidence that the two of them will be implemented in stages parallel to each other. Thank you so much for joining us.
Thank you.
So as much as we can exercise to develop our physical being, let's look after those organs that we don't see every day. Your mental health issues. Let's be mentally healthy. Your heart. So let's, in overall, let's exercise. Let's live healthy. Let's eat healthy. One of the best ways of distressing and remaining calm, funny enough, is being physically active and exercising at all time. It has a calming feeling, and after that, just taking a nice warm bath or a nice warm shower really calms you down, and you relax and unwind from the daily stress. As parents, we have a buzzy day and a busy day, so let's take time for ourselves and look after ourselves, because when we do that, we are truly, indirectly, looking after our children and building the future of this nation. Magxala, it has been absolutely fantastic. Let me thank the producers and the technical team of this program, Healthy Living on Ncdohtv, brought to you by the Northern Cape Department of Health. Magxala, till we meet again. Good night.